Wonderful. All right. Well, good afternoon, everyone. Welcome to Trust for America's Health's Age-Friendly Public Health Systems monthly training for October. We're really happy you're joining us today to learn more about how the public health sector can support older adult health and well-being, and in partnership with other sectors across the age-friendly ecosystem. My name is Megan Wolf, and today I am not joined by my partner, Dr. Karan Phillips. She's out of the office this week, but I am joined by our policy development intern, Rebecca Bass. So happy to have Rebecca here. The age-friendly public health system movement would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Okay, can we go to the next slide, slide 2, please? All right, so if you all could please keep your devices muted during the presentation today, that will help us avoid any kind of background noise or disturbance. And for today, you can put your questions in the chat, but you can also raise your hand, and our guest speaker would be happy to entertain questions throughout the presentation today. Next slide. So all of our trainings are recorded, and the slide deck is shared with registered attendees after the training. We also have a policy that if you're using an AI note-taking tool, please let us know by commenting in the chat before our speaker begins. And in addition, you must be present in the training with the AI note-taking tool, and any notes generated from the tool can only be used for personal use. Next slide, please. Your feedback on our trainings is very important to us. It's really valuable, helps us to identify where we can improve and how we can move forward. So we would appreciate if you would take just a few moments after the session today to complete an anonymous feedback survey that will just pop up on your screen at the end. It'll just take a couple minutes. Your insights will be shared with our evaluation partner, the New York Academy of Medicine, and as I said, will help us to enhance future trainings. Next slide. So as most of you know, if you've been with us before for these trainings, Trust for America's Health, or TIFA, as we're commonly known, is a public health policy research and advocacy organization dedicated to optimal health for every person in every community. TIFA produces several reports annually, and today, we didn't get it on the screen here, but we just released our 2025 State of Obesity Report, and you can find that on the TIFA website. If we have a chance, we'll put the link for you in the chat. We also publish periodic briefs related to our age-friendly public health system, or AFPHS work, and we recently published one just about a month ago on caregiving and public health's role in supporting family caregivers, and you can access that brief on the AFPHS website, and we'll put that in the chat at some point as well. Just wanted to say, I think I said, but if I didn't, I would need to recognize that our AFPHS work would not be possible without the generous support from and partnership with the John A. Hartford Foundation. So we're very, very grateful for their investment in older adult health generally, and the policy work that they support. Okay, next slide. So I'm really pleased today to introduce you to a wonderful age-friendly ecosystem partner, Mary Eck. She's the director of Dementia Friendly America and Community Care Core. And Mary was one of the authors featured in the spring edition of the Generations Journal issue, the special edition on the age-friendly ecosystem. Today, Mary will be providing an overview of the dementia-friendly movement and highlight the importance of integrating dementia-friendly practice into the broader age-friendly framework to build more inclusive, supportive communities for all older adults. So welcome, Mary. We're so happy to have you here.
Thanks so much, Megan, and thank you, Rebecca, for having me join you today. I'm always thrilled to talk about the Dementia Friendly America movement, and grateful to be part of the age-friendly ecosystem work, knowing that we're better together. And I'll say more about being better together with age-friendly and dementia-friendly. But I will start by saying that, as Megan mentioned earlier in the publication that TIFA just put out, we also, while we do support people living with dementia, we are also supporting caregivers in the work we do, and you'll learn more about that as I go through my presentation. So we can jump right in and go to the next slide. I guess I can say a little bit about. I think there was one that's, yeah. There we go. I'll tell you a little bit about my history first with Dementia Friendly America as it relates to this slide. So Dementia Friendly America began as a statewide initiative in Minnesota. That is where I am from and where I work remotely now for Dementia Friendly America. But it began as a statewide initiative, recognizing that by 2020, baby boomers would be reaching 65 and older. And as a state, we would be facing a lot of issues related to sustaining caregivers, raising awareness about dementia, the economics around dementia, creating dementia-friendly communities, sustaining caregivers. And so they started a group, and it was actually called Prepare Minnesota for Alzheimer's in 2020. That then the name became Act on Alzheimer's. And one area that they particularly focused on was creating dementia-friendly communities. So that effort took off in Minnesota, and I was the project manager for that effort back in 2011. And it really took off in Minnesota through the area agencies on aging there, and it got recognition nationally. And at the White House Conference on Aging in 2015, Act on Alzheimer's was adopted as a national initiative. So all of the resources out of Minnesota were adapted for a national audience and became Dementia Friendly America. US Aging, the membership organization for the area agencies on aging housed in Washington, D.C., stepped up as the administrators of Dementia Friendly America, knowing that they had the reach to all of the area agencies on aging across the US, so 900 plus, and knowing how the AAAs in Minnesota helped get the effort going there, they realized that we had an avenue for piloting this movement nationally. And so we started with 6 pilot communities back in 2015. And we have over 400 dementia-friendly communities. So you'll see just in this little graphic here, it shows the different sectors of a community and how we can all work across sectors to create a dementia-friendly community. So I'll go through a little bit more in the next few slides about what how our model works and how the movement has grown since 2015. But I started in Minnesota, worked on it for a while. It lived at US Aging for a number of years. And then when during COVID, when more remote opportunities started coming up, I was asked to come back and serve as the director of the national effort. And so it was just an absolute thrill to see something that we handed off with 6 pilot communities, survived through COVID, survived through limited funding, unlike US Aging, who receives money through the Older Americans Act, and that's how the AAAs are funded. DFA is just a program administered by US Aging. We don't receive any federal funding. So all of our funds are through donations, sponsorship, grants, and just private philanthropy. So that's how we keep this movement going. So I'll tell you what we do if you want to move to the next slide, please. So our mission, pretty simple. Increase dementia awareness, reduce stigma, provide quality dementia resources, create environments where people living with dementia and their care partners can live, engage, and thrive in community. And when we think of our vision, we want this to be in community no matter where they live. And so our goal is to create a nation where no matter where you live, much like age-friendly communities, you can engage and thrive in community. We do know that over 80, I think it's 83% now of people living with dementia live in their homes with a care partner oftentimes. And, in alignment with US Aging, supporting older adults and adults with disabilities so that they can remain in their home. DFA has the same mission. How can we create communities that allow people living with dementia and their care partners to remain in home and community for as long as possible? So we value belonging, we value meaningful engagement, collaboration, partnerships and knowledge, and then quality resources to support these dementia-friendly efforts. And I'll share a bit more about those on the next slide. And if you have questions, I can't see who's raising their hands, but feel free to interrupt if you have. I'm happy to stop and answer questions. This is just, I'll give a quick overview about DFA in general, and then I'll share at the end kind of how we both work with and align with age-friendly efforts in public health. So right now we have 29 community conveners, and those are organizations that convene and provide support in their state to all of the communities within their state that are working on implementing dementia-friendly efforts. We have 43 states that have communities. We've had consistent growth, upwards of 400. I think we've exceeded 400 now of communities that have joined the DFA network. 37 sub-license holders, and those are states that have the license to deliver our Dementia Friends sessions. That also includes some territories. We are approaching 230,000 Dementia Friends. I think we actually just exceeded that number. And we continue to build new partnerships and new resources, and I'll tell you a bit about those on the next few slides.
Mary, before you go on, can we go back to that last slide real quick? So 230,000 dementia friends, that's amazing to me. So who is a dementia friend? Like who can anybody be a dementia friend? Could I be a dementia friend?
Anyone can be a dementia friend, and if you can sit tight, I'll tell you all about our Dementia Friends effort. We'll jump into community, and then Dementia Friends is the individual effort. So this is just a highlight of what's to come, and I'll get into details about all of those.
Awesome, thank you.
Sure. So DFA serves as the backbone of this dementia-friendly movement. So we are, and you'll notice the C's here, and pay attention to the C's because they align with the 6 C's that you'll be seeing later in a later slide showing our alignment with some age-friendly work. But so DFA serves as a clearinghouse of resources and directories, all related to dementia-friendly efforts. We convene people that are engaging in this work, both at the national and local level. We are a connector of communities. You know, we hear of one community doing similar work, we connect them to another community with similar demographics. Communicator through our newsletter and through our outreach about what's happening in various communities and at the national level as it relates to dementia-friendly efforts, collaborating across sectors, both at the local and national level, and then cultivating new partnerships, helping people see, you know, where we align with their efforts. So we can jump to the next slide. Our reach as the DFA network, you can see here, we cover many areas, and I took the slide and added stars where, you know, we tie into public health, and that's mostly, you know, in our communities where we have public health representation on our action teams. Our Dementia Friends are, you know, when you think of awareness and education, which is a huge part of public health efforts, it's raising awareness and educating people about dementia. And then with our national affiliations, like DFA's work with the age-friendly public health ecosystem. We have worked with AARP and their age-friendly community efforts, the Alliance to Improve Dementia Care. So we are very active also at the national level with the BOLD grants and the Brain Health Action Committee. So you can kind of see while our work is dementia-friendly focus, we touch a number of areas across the aging network. Next slide. So these are the initiatives that we have that kind of fall under the dementia-friendly movement. We have our community effort, which focuses on creating dementia-friendly communities. We have our Dementia Friends effort, which is when an individual becomes a dementia friend, and I'll tell you more about what that opportunity looks like. And then we have our Memory Cafe Alliance, which is a directory and resources for starting a memory cafe, which is an engagement opportunity for people living with dementia and their care partners. And I'll go into detail on each of these in the next few slides. So a dementia-friendly community as you can imagine, is informed, safe, and respectful of individuals with dementia, their care partners. And it's, in addition to providing support, we focus on quality of life. So it's not just being supportive, but providing opportunities for engagement, authentic engagement, not just superficial engagement. So knowing that people living with dementia can live well for a long time and continue to engage in their community. And if we do want them to be able to remain in their homes, we have to create that sense of community that allows them to do so. And to join the DFA network means a community is working to become more dementia friendly. We are a certification or a designating group, primarily because the folks that are doing this work at the local level look very different. We have some efforts that are run by volunteers, some that live in a Department of Health or a Department of Aging, some being run out of their area agency on aging. And at the national level, we have about 1.5 staff members, so myself and a colleague. So to be able to audit each community who's doing the work is just not possible. So we look at DFA as a movement, people that are engaging in the work, and depending on their capacity and resources, they are doing what they can, and they're doing incredible work. It's been amazing what communities are doing at the local level, and even what they're doing just as volunteers and the impact they are having on their communities. So it's they take a community approach. We ask that they include at least 3 sectors of their community in their efforts, of course, including people living with dementia and care partners in the planning. And I'll show you kind of what an action team looks like, and then adopting dementia-friendly practices and goals. Next slide. So this is our network. So the states that you see in purple have dementia-friendly communities. We have 43 states with communities that have joined the DFA network. And then, oh, I'm not sure what happened to the slide. It looks funny on my end. There are over 400 that have joined, and then we have 29 states that have a community convener, and that is an organization that has stepped up to kind of convene the communities in their state so they can share resources. Some have multi-sector plans on aging for their state. And so these conveners kind of pull together the community leads of each of the communities in their state to help build momentum, to spread it throughout their state, and to just to align the resources with each other. And so they convene with their community leads in their state. We at the national level have bi-monthly convenings of the state community conveners to as an opportunity to collaborate, share resources, troubleshoot, and they've really valued that time to collaborate. I found in this work, people are so willing to share the resources that they're creating, which has been so helpful because, as I mentioned earlier, the capacity and resources from state to state or community to community vary greatly. Next slide. So to join the DFA network of communities, we have a readiness and recognition criteria for communities to consider. They complete an online application. They provide 3 or more letters of support from the various sectors that are engaging in the work with them. And then if they do have a community convener in their state, they need to, have a letter of support from them that they are joining the effort. And so when they do join, they receive our logo. They receive a customizable logo where it can be, Dementia Friendly Massachusetts, or it can be even more granular, Dementia Friendly Austin, so they can adapt the logo for their use. But we really encourage that because we want people to see that this is a movement. So we ask that they really do co-brand with us. Next slide. So our most popular tool are sector guides. And so the sector guides, when we talk about engaging multiple sectors in the community efforts, we provide guides that walk through step by step how to make your sector more dementia friendly. And so you can see here we have, our local government, airports, banks, museums, we are adding more sector guides. We're looking now at salons and more entertainment, postal service. We are building out a dementia-friendly dining, kind of a more robust dementia-friendly dining certification so that we can eventually have a directory of dementia-friendly restaurants. But even with this, we have communities that are going to their local diner or local restaurants and teaching them how they can make their restaurant more dementia-friendly. So that is one approach that communities will take, is just going sector by sector and training them in using our sector guides to be more dementia-friendly. We also have a toolkit, and it's a step-by-step from doing a needs assessment, developing priority areas, and then a work plan and it's a step-by-step guide with all of the resources attached to it that they can carry out from beginning to end, which is not we find that people are not using that as much as the individual sector guides. Many communities come to us already knowing what the needs are. They've already done a needs assessment. And because we keep our model flexible, they can come in at whatever stage they are. They don't have to do the toolkit yet there for their use if they'd like to use that. But many come in and say, we'd like to start in the faith sector. We'd like to start in our libraries. So we ask, just where is the low-hanging fruit? Where can you build momentum? And that's often how they begin. All right, next slide. So Megan, this is what you were asking for. So this is so I shared about our community initiative. Well, Dementia Friends is the individual impact, and they can work together, and oftentimes our communities use the Dementia Friends curriculum as their education and awareness approach. So any individual can become a dementia friend. We have an online curriculum that one of our champions delivers online, and it's an interactive curriculum at about an hour online to become a dementia friend. And this is often embedded in our communities. It's not required that you use Dementia Friends for your education and awareness, but it's such an incredible program that many people do. So that's the 230,000. So people can attend an in-person session in their state delivered by a champion, or they can become a friend online. And if you go to the next slide, I can tell you a little bit more about that. So Dementia Friends began in Japan, and shortly after we started Dementia Friendly America, we acquired a sublicense about a year later in 2016 to be the hosts of Dementia Friends USA. And so Dementia Friends is a 1-hour session where you learn to recognize the signs of dementia, how to respond to people living with dementia, communication tips, a little bit more about the disease itself, and then you commit to taking action as a dementia friend. So that can be encouraging someone else to become a dementia friend. It can be joining your local community effort, helping a neighbor, volunteering at a memory cafe, or just seeing people living with dementia and responding based on what you've learned. And, this has been really interesting to me because it's, we're very careful to say it is an information session. You're not becoming a dementia specialist. Anyone can become a dementia friend. And as you can see here on this slide, we have curriculum for kindergarten through 2nd grade. And this has all been developed by our sublicense holders. So the way it works in the US is we can issue one sublicense per state, and whatever organization takes on that role as the sublicense holder agrees to make that curriculum accessible in their state through training champions. So it's a train the trainer model, and you train champions to deliver these information sessions. And anybody who is interested and it can deliver the sessions. You don't have to be a dementia specialist or a medical professional. It can be anybody who is interested in delivering the sessions, and then you have access to the curriculum and then access to our Dementia Friends huddles, where we gather as champions and as sublicense holders to share ideas, to share curriculum. So we have our curriculum is available in over 20 languages. We have a curriculum for kindergarten through second, third through fifth. They created one for the IDD population, and it not only is designed for the IDD population, but is often delivered by someone with an intellectual or developmental disability. So it's just really, it's incredible. One that has taken off in Ohio with huge success is Dementia Friends in incarcerated settings, knowing that they are dealing with dementia in incarcerated settings, and they are inmates are becoming dementia friends to each other and providing support to each other. So it's not only for those living in incarcerated settings, but for those that are working in incarcerated settings. And they put that into an online curriculum through like a learning management system for employees at incarcerated settings. And we've had thousands become dementia friends. We also worked with IA Squared and Nevada, the University of Nevada, to create an adaptation for American Indian and Alaska Native communities, knowing that the original Dementia Friends curriculum just did not speak to that population, to that culture. They couldn't relate to how it was being delivered. And so we worked with them to create a curriculum that is more kind of a storytelling, and it kind of follows, there's like the river story and the tributaries of the river, and kind of as you age, what can happen, and that's been very well received by that population. And we just added one, a pictorial version, and that's for people with lower literacy skills. So they've just taken off with this, and it's been incredible. So we've completely relied on our sub-license holders and the champions at the state and local level to build out these resources. And so once they develop a resource, they're more than willing to share, and then those resources can be used, in any state. We encourage people to attend an in-person. If they can't do an in-person, then as I mentioned, we have an online opportunity, and the champion who delivers that is out of this world. Colleen Fritsch is amazing. So if you have a minute to do it, I encourage you to become a dementia friend. And the idea is, I believe that people want to do well. They want to be kind. They want to help people. And when they don't, it's usually because they're either afraid or they're not sure what to do. They think they might do the wrong thing. And it's just usually a lack of understanding. So the idea of Dementia Friends is to teach people to walk toward people living with dementia rather
2
than
hours.
away. And if they feel equipped to be
Yeah.
able to do that and do that well, then they will. And I think attending a Dementia Friend sessions, people often feel like, oh, I can do that. It's really about being kind. It's really just about seeing people and taking a little extra time. It doesn't have to be big, and I don't have to be a professional to be able to do this. So it's been very well received. And it's also being used with like medical residents and like dementia friendly healthcare. So again, even just the waiting room in a clinic, how can you make that more dementia friendly? So really not, it's non-medical, it's very just about environment and community and making it more welcoming.
Yeah, I love that the whole idea of this, Mary, and 1 hour, like just 1 hour to attend a training, and then you can become a dementia friend. So, and I also love the idea that these resources are being developed in people all across the country in different states, but then they're being shared.
Yeah,
And that is just a gem. That's so valuable.
it is, because, like I said, people have different, resources to do this. And they're like, hey, we have some money, we can translate this, and great, do it, we'll share it, and anybody can use it. So it's really been a collaborative effort to move this forward.
Yeah.
It's really been fantastic. Okay, next slide. A newer partnership that we developed is with the Memory Cafe Alliance. And so when I talked about communities and having engagement opportunities, it was just a natural fit for us to partner with the Memory Cafe Alliance and host their directory on our website, along with their online training and resources for memory cafes. So for those of you who may not know, a Memory Cafe is an opportunity for people living with dementia and their care partners to spend time together doing an activity, listening to music, playing their own music. It can be a craft, it can be a speaker. It's not a support group. It's not about dementia. It's just an opportunity to have fun and to enjoy time to have a person living with dementia and their care partner enjoy time with each other in a safe environment that is dementia friendly and represents kind of what they can do and what would make them comfortable. It's usually involves food. It's very low cost. They can be hosted anywhere. Oftentimes, it could be at a senior center or a faith community. Sometimes restaurants will host them. And it's a great way for communities to get involved because they can, a business could offer to host the space and the bakery can offer to provide refreshments. But it's really taken off. We have over 600 memory cafes on our directory at this point, and that number continues to grow. The directory, it was intentionally designed. It can be searched by location, knowing that, people living with dementia are still traveling or they might winter somewhere else. They can be offered in various languages at different times of day, depending on what works for the person living with dementia and the care partner. But we also, as we talk more about social prescribing and what to do after a diagnosis, our hope is that when someone receives a diagnosis of dementia, part of their aftercare or their package that they receive for, what do I do now? They can get a list, they can print out a list of either memory cafes in your area or within 20 miles of where you live. This is something that you and your loved one can do together. And we're hoping that the same will be true, that, you are part of a dementia-friendly community. You are, there are dementia-friendly restaurants here. And we're hoping that eventually becomes the norm. Like, okay, this is a difficult diagnosis, but look at all these resources we have to support you so you can continue to remain in your home and live well in community and enjoy the things that you had enjoyed. And there are ways to still do that. So that is our dream for DFA. All right, so this is just a snapshot of what the directory looks like on our website. So you can put in a search and see where they're located and kind of get the details of the Memory Cafe.
And I
Next
just
slide.
accessed that while you were describing it and found out that there are 13 memory cafes in my little area here. So
Yeah,
that's really exciting. It's really exciting.
yeah, it is. It's really, and there was a Memory Cafe directory. We learned this when we partnered with them, that a gentleman was trying to manage, which he just couldn't do it as one person. And at one point, I think he had almost 900. So we're trying to get all of those to engage in this directory. And some of them fell off and are no longer, but I'm confident that we will get this up to 1,000 very quickly because we know they're out there. We're just trying to get them all in one place so people can access them.
Yeah, that's awesome.
Yeah, yeah. All right, next slide. A partnership that we are just starting is with Giving Voice, and those are dementia-friendly choirs, and that's an opportunity for people living with dementia and their care partners to sing together in a choir. We had a dementia choir open up the U.S. Aging Conference back in July, and it was incredible. It was the highlight of the conference for so many. You've all probably read the literature on music and how therapeutic it can be, and just how it does, how people living with dementia can recall songs from their past, and it can be very soothing and comforting and fun. And this has been just an incredible way for both people living with dementia and their care partners to enjoy time together. And the number of choirs is growing. I think right now there are about 75 choirs in this Giving Voice network. And so we're using a similar model to that of the memory cafes, where we'll have a directory of choirs that people can join if they choose to. So it's really been amazing. I went to a concert at Orchestra Hall in Minneapolis. The house was packed, and it allowed, they started with a Dementia Friends session for all of the orchestra staff so that they could welcome the group in to sing. And the choir went on for like an hour and a half. They were out of this world great, but in the middle of it, one of the people living with dementia walked off the stage, climbed down the front of the stage, and no one skipped a beat. It was just all handled so lovely. And the joy that was in that house by everyone was just amazing. So I'm really excited about this effort, and to just show people when they do come to our website, they're like, oh, yet another engagement opportunity. Oh, this is something we can do, and it's easy and fun. So I'm excited to see kind of this clearinghouse of resources grow, both with tools for creating communities as well as really authentic engagement opportunities. All right, next slide. So part of the reason I'm here is to talk about how we align with age-friendly and public health. And I would say our work began joining age-friendly with this publication. But I just want to give a little statistic that I probably should have put on a slide, but when you look at the Alzheimer's Association facts and figures, 1 in 9 people age 65 and older have Alzheimer's. And that's just Alzheimer's. That's not including other dementias. So when we look at those numbers, today there are over 7 million people living with 7 million Americans living with Alzheimer's. By 2050, they expect that number to grow to about 13 million. And as I said, 85% of those people are living at home in community. So how is this not a public health issue? Like this is a public health issue. And if you are thinking of age friendly, you have to think of dementia friendly, because you are aging with dementia. And so we did this way back, I believe it was in 2012 or 2013. We started the conversations. AARP was involved in Minnesota's work, but they created this publication, Better Together, and you can see it's kind of an overlay of how age-friendly and dementia-friendly align. And while there is alignment, there's just a little bit more to do to make it dementia-friendly. But isn't it worth it? If you're going this far, then take that extra step to really be intentional about, yes, this is age-friendly, but now what is it being age-friendly and living with dementia? Because they don't always go hand in hand, as this audience will know. All right, next slide. So DFA and age-friendly ecosystem alignment, you can see that we, when you look at the breakdown of the age-friendly ecosystem and who we work with in our action teams, it's very similar. We are working across sectors. There really isn't anyone who can't engage in this work. It touches everyone. And then if you can't see how it touches a person living with dementia, you can appreciate the impact it is having on the caregiver. So those, being in public health, being in age-friendly efforts, I'm preaching to the choir, but I shared this slide just to show that, when we thought about who would be engaging in an action team, it very much aligns with the thinking around the age-friendly ecosystem. And we have communities, that's fine, Rebecca. We have communities that are part of BOLD grants that are getting some BOLD grant funding. They have public health, as I mentioned, represented on their action teams. They're part of their multi-sector plans on aging, the Healthy Brain Initiative roadmap. Dementia-friendly communities are part of that roadmap, and many of our communities are engaged in the Healthy Brain Initiative. So it is happening definitely at the local level. and we're trying, to have dementia and the DFA movement recognized more nationally, that this is important and we have the resources. And clearly, I think the proof is in the pudding that we haven't had funding, yet we have all of these resources, and people are just making them because we need them and sharing them because they know we need them. And so our hope is that this, movement continues to grow and that it is recognized more nationally that we have to address this. This is an issue of public health, and there are ways that we can address it in alignment with other great efforts that are happening in the age-friendly space and public health space. So those 6 C's that I mentioned before, we also have our 6 C's. And while they're not identical, I think you can see it's a similar approach. Now, we haven't done much, unlike US Aging, who was very big on advocacy for older adults and adults with disabilities, and making sure that the area agencies on aging continue to get funding to support those populations. We haven't had the funding to really build out our advocacy. So we are just doing what we can at the local level and state level, and convening people and pulling them together to share their resources and build out this work, and creating a national presence for this work. So as I mentioned earlier in the presentation, a clearinghouse for resources, convening people both at the local and state level and at the national level, connecting communities who are doing similar work, communicating this work. We send out a monthly newsletter highlighting new communities that have joined, our number, Dementia Friends that we've had that month. We collaborate, we're part of a number of alliances, and getting into that space and saying, we need to be, dementia needs to be at the table. Dementia, if you're talking about age friendly, you have to be talking about dementia friendly. If you're talking about public health as it relates to aging, we have to be talking about dementia. And then just continuing to cultivate new national partnerships and alliances to grow our library of resources so that we can continue to support the work at the local level.
I think that, and public health practitioners who are aware of the need for public health engagement in aging and addressing older adults. I think most of them do kind of understand the need to engage in the dementia field, and it is often, we've seen this across the country, it is often the first priority that especially local health departments are able to address in their community health improvement planning is Alzheimer's and dementia. And it's like the foot in the door for other healthy aging priorities. So it's a very important issue, public health issue, and important for so many reasons. But yeah, I appreciate your elevating that for this audience.
Yeah, and I think our resources are designed for anyone to use, which I think is why this has taken off. They're not intimidating. They're not, I don't know, for lack of too technical. It's really simple things, and you can build it out as much as you want to, but it's really manageable. And it's when people have a desire to do something, and then they see, oh, how easy it would be for us to have name tags at these events, or certainly we can have, add another service that is shorter with different kinds of music and large print readings, at our faith community, like some simple things that don't have to cost a lot of money. And you don't have to do it all, if you could do 3 things that make it that much more welcoming. So I think by default, our flexible model has allowed this this effort to expand, because we don't turn anyone away from wanting to do this. Just start,
Yeah. No, it's great, and I think that the flexibility and the opportunity to do the assessment and kind of identify the needs, but also identify where are those open doors, like what, where could those first steps be, make those simple, kind of get started, and then begin to build on that. So I love the approach.
Yeah. Yeah, our kickoff events that communities have been just incredible because they'll start with kind of somebody living with dementia and a caregiver telling their story about what it's like to navigate in the
Mhm,
community. And then,
mhm.
and then people realize, oh, I didn't even realize you had dementia, or, oh my gosh, maybe that's what was going on when this person came into my store. And it just like right away gets the conversation going. And the ideas started, oh, well, we could do this. Well, oh, it'd be easy for us to change this, or we'd be happy to host this. And it's just incredible because once people realize that most people can realize right away that they know somebody living with dementia, have cared for somebody living with dementia, they can relate right away.
Mhm, mhm.
And I was just on a call earlier, realizing that all of these efforts, just like age friendly, it's not just supporting the aging or those living with dementia. And
Yeah,
we often use the analogy of the curb cut. It's like, okay, well, that was intended for wheelchairs, but look at how many people benefit from the curb
yeah,
cut. And the same
yeah.
is true for this work. The benefits for people living with autism to have low sensory movies or movies with a break can help people living with autism or other sensory issues.
Mhm.
So it's just been a great effort, and it continues to grow, and I am just determined to to keep these numbers growing and to get the word out about this. It's good work, and it's too important not to.
Yeah, yeah. I love it. I love that it's community based too. It's
Yeah,
really, you've got that growing from the ground up. So
yeah,
that's great.
exactly. Okay, what else did I have here? Next slide. Oh, this is just another example of how we're working with public health. So Dementia Friendly America has been involved in each of these public health centers of excellence. Certainly, how does our work support caregivers? And we're often a vehicle for just dissemination and getting information out to our communities. Certainly supporting risk reduction. We've added brain health materials, and that started with our adapted Dementia Friends curriculum for the American Indian and Alaska Native community. Knowing of the prevalence, there were a lot of questions when the session was delivered, and those like, well, what do we do about brain health? Um, how do we prevent this? And while we know we can't, you know, there's not a cure and we can't prevent, we can delay the onset, we can take care of our brains. And so we've added supplemental materials around brain health that people who are delivering a Dementia Friend session can either embed into their Dementia Friend session or extend their session for people that want to stay and learn more about brain health. We've developed materials to support that. And then obviously the early detection, we believe that people would be more inspired um, to go in for an assessment if they felt like they were in a community that could support them upon
Hmm.
diagnosis. I think it's so much of what will I do? Where will I go? Who will take care of me? And if they saw that they were surrounded by resources and a community and opportunities to continue to live well, that early detection wouldn't be so scary.
Hmm.
And it wouldn't
Hmm.
be so scary for providers. I think
Yeah.
providers often feel, great, I have to give this news and I have nothing to offer. Well, wouldn't it be great if they gave a diagnosis and said, and and you are fortunate to live here because this community has all of these resources for you. And it's not just support group, it's engagement. It's, ways to live well. Oftentimes you can be independent for much longer if you're in a supportive community. So that's the goal, is to kind of serve all of these areas of public health through our community efforts and just strengthen their work through our community efforts.
And I would think it would be really, really encouraging as well for caregivers and for people who are not just looking for for respite, but for how do they really support the person that they're caring for and like helping them to stay engaged in ways that are meaningful. So
Right.
yeah, that's great.
Yeah, that's a big piece. And I the memory cafe piece has been big because people, when they realize it's not a support group, and that's just awareness that we have to be very intentional about, because people do think it's a support group for caregivers. And while it's not that, I think of my neighbor who, Roger and Beth was living with dementia for 10 years. They started going to a memory cafe right after she was diagnosed. And Beth died 5 years ago. And Roger still, there are two people left from that memory cafe. They met every week for 20 years.
Wow.
And, and they are, to this day, like, they would meet outside of the memory cafe, and they formed this incredible community. And that wasn't the intention. So they still enjoyed, activities together at the memory cafe, but the support it provided for caregivers, post, outside of the memory cafe. And it was just incredible. Like, it's just all of these, indirect impacts that these efforts have is really
Yeah.
incredible.
Yeah. Love that.
All right, let's see. Oh, I'd like to invite you all to our Dementia Friendsgiving event. On November 18th, we are going to be celebrating 10 years of Dementia Friendly America, and we are going to be hearing from a number of our communities, from our Dementia Friends leads. We're having a panel of people just with lived experience, talking about the impact our Dementia Friendly efforts have had on their lives. Tifa Snow will be presenting, and she is just an incredible expert on dementia and working with people living with dementia and supporting them. So she will be our keynote speaker. And we're going to have a potluck, which is going to be really cool, an opportunity to share either your own memories of either friends or family who were living with dementia, or just something meaningful to you, or it can even just be a Thanksgiving recipe. But it's going to be a potluck or to share a resource that you've discovered that helps you with your dementia journey. And then we'll have an after party where people can do a deeper dive into either learning more about our community effort, our dementia friends, our memory cafes, our choirs. And you'll have a panel of experts in each of those breakout rooms to answer your questions and learn more about those efforts. So we really encourage everyone to attend. And I can even if it's easier, I can put the link.
Yeah, that would be great. And that's a virtual event, right?
It's a virtual event. Yep.
Yeah. Okay. What a great idea. Very unique.
Yeah, it's our first ever. And so we're excited to be hosting it. And I think we have over 600 people registered so far for it. So we're excited, but I just put the link in. If you'd like to join us, we'd love to have you there, and you can hear from the folks doing the real work at the local level. I just get to I'm working hard, but I mostly get to report on the great work they're doing at the local level. It's just been a huge privilege to do this work.
So, well, I just put it on my calendar, so I'll remember
Great.
to sign in.
Great. Yeah, even if you can just attend for a little bit,
Yeah.
whatever works, we'd love to have anyone there. But I'm happy to answer any questions. I know I talked a lot, and I'll say now I can stay on a little bit if you need me to, and also happy to you can reach out to me if you have questions.
Awesome. Great. So can we take the slides down for a moment and then see if anybody has any questions? I had a couple at the beginning, but I think you answered them all. So so
Okay.
I don't have any other questions, I don't think. One question I have about dementia, and this is really more of a clinical question, I guess, but so dementia, so Alzheimer's is an official diagnosis, but then so are a number of different types of dementia, right? They're
Right.
specific diagnoses. But is dementia considered a disability?
That's a good question. I think it has to be a specific type of dementia that
Okay.
they'll call it. Yeah. So, and that it's interesting that you asked that, because there's been a lot of talk about the term dementia. So dementia is really kind of the umbrella term, and it's really symptoms that are tied to different types of dementia. So there's Alzheimer's, there's the frontal temporal, vascular, Lewy body. And so but dementia, people can experience signs of dementia with concussion, different head injuries, different medications, or, being dehydrated. So, so there are a lot of things that can make one show signs of dementia, but I think it's specifically for it to be a disability. I think there has to be a
diagnosis,
of a specific type of dementia.
Okay, that makes sense. I mean, a lot of times in public health, we talk about brain health and cognitive decline, which is leading to a dementia, right? One of the dementias.
Yeah, but that's why it's difficult, because with the different types of dementia, it's not always memory loss. It's not always so, and I think there are some that are trying to get rid of that word dementia. And our approach is, well, let's just destigmatize that word. We don't say demented, and because that has a different connotation, but what other word is there that kind of covers the whole, it's not just about brain health. It's not, well, they tried to change dementia on the DSM, when you fill that out, when you go in for your doctor's appointment, are you showing signs of, they tried to change it to, are you showing signs of neurocognitive impairment? And people didn't know what that meant. So then they ended up having to put dementia in parentheses, because people knew dementia, but they didn't know. So it's a tricky one, it's because some people don't like that word still, but we're just, well, it's, we just have to destigmatize it and talk about it.
For sure. Well, this has been so informative and so helpful, and honestly uplifting. So I really appreciate your being here, Mary. And we are at the end of our time. So I'm going to ask Rebecca if you would bring the slides back up. I just have a couple more slides to share with you all some information. So go to the next one. Our next training will be on November 20th at 3 p.m. Eastern, and we will continue our journey through the age-friendly ecosystem. And so hope that you will join us for that. You can register for any of our trainings under the events tab at afphs.org. And next slide. So for those of you who are pursuing the age-friendly public health system champion designation, and you're watching this training as part of that, if you're watching the recording right now, we would ask that you would pause the recording, complete the survey, and that will let us know that you've actually viewed it, to help us track your training attendance so that we can give you that designation. So if you would just pause the recording and use that QR code, then we can track your participation. And then the next slide is just a thank you for attending, and really appreciate all of you being here with us today. We had a really good audience. We didn't really have an opportunity for engagement with all of you, but I hope that it was informative. Mary, it was so good to have you here. And please let us know if we can return the favor anytime. And we'll look forward to seeing you on our next Age-Friendly Ecosystem Partners meeting.
Great. Thank you so much. It was I was so honored to be asked, and thanks to all of you for attending. And please reach out if you have any questions or want to learn more. And we hope we see you at the Friendsgiving event on the 18th of November.
Awesome. Sounds great. All right. Thanks, everyone.
Take care. Bye-bye.
We can stop the recording.